Welcome to Resource on the Go, a podcast from the National Sexual Violence Resource Center on understanding, responding to, and preventing sexual abuse and assault. I'm Sally Lasky, NSVRC's Evaluation Coordinator. This is part one of a three-part series on what an intersectional approach to data collection, analysis, and use can look like. If the concept of intersectionality is new to you, please check out the show notes for grounding resources from Kimberly Crenshaw. Like the podcast, Intersectionality Matters with Kimberly Crenshaw. You can pause and come back. We will totally wait right here. When you are ready to dive into part one, you will be able to hear our guests, Corey Cole, an applied epidemiologist in the Injury and Violence Prevention section at Minnesota Department of Health, Barbara McMorris, associate professor in the School of Nursing at the University of Minnesota, Marissa Regay, the evaluator for the Sexual Violence Prevention Program at the Minnesota Department of Health, and Nick Ryder, associate professor at the Institute for Sexual and Gender Health at the University of Minnesota Medical School. They talk about their collaborative work to build intersectionality into their sexual violence prevention data analysis of the Minnesota Student Survey. Welcome to Resource on the Go, everyone.
Hi, Sally.
Hi, Sally.
Hi.
So glad to have you here. Could you each share a little bit about yourselves for our listeners? Corey, could you get us started?
Yeah, my name is Corey Cole. I use she, her, and I am an applied violence epidemiologist at the Minnesota Department of Health in the Injury and Violence Prevention section. And my job is to figure out how do we collect all the data that we can get about sexual violence, intimate partner violence, and all of the things upstream that affect sexual violence, and then how do we translate that data so that it's usable for the prevention and advocacy work that's happening around the state.
Hi, I'm Barb McMorris. My pronouns are she, her, and hers. I'm a sociologist who has found a home as a faculty member in a school of nursing at the University of Minnesota that values interprofessional teams. My research focuses on adolescent and young adult health. I'll pass to Nick.
Hi, everyone. I'm Nick Ryder, and my pronouns are they, them, or just my name. I'm a faculty member at the Institute for Sexual and Gender Health, and I'm the director of the National Center for Gender Health, and both of those are housed within the University of Minnesota Medical School. My research focuses on contextualizing health inequities and examining social and structural factors that affect various aspects of well-being for marginalized communities.
And good morning. Hi, everyone. My name is Marissa Regay. My pronouns are she and her. I work at the Minnesota Department of Health in the Sexual Violence Prevention Program. This is the program at the Minnesota Department of Health that receives the rape prevention and education funding from CDC, the Centers for Disease Control and Prevention. I am the evaluator for the program. I've been a part of the program for over 10 years now, and preventing sexual violence is my passion area and really what drives me. I got into public health work in order to focus on this upstream primary prevention work.
Oh, and I'm so glad that you all are sharing those passions with us today. We've got a lot to talk about, and it would be great to begin at the beginning and what brought all of you together.
Yeah, so our RPE funding requirements includes a lot about data to action and evaluation regarding disparities in sexual violence and health equity. This is something that Marissa and I collaborate on very frequently within the department, and our favorite data source that we use to do this is the Minnesota Student Survey, which is this gigantic survey of students in grades 5, 8, 9, and 11 that asks them about every topic a youth could possibly care about, including sexual violence. And some of the questions were specifically created by our team using feedback from youth. We use a survey from year to year to look at disparities in sexual violence, and we answer a lot of classic data questions, like which students are experiencing the most elevated burdens of sexual violence and how are trends changing over time. To answer these questions, we do a lot of, data analysis, like pages and pages of charts and bar graphs, and going into each type of disparity and breaking them down further where it's appropriate. But, as we continued to report this way, we realized that we were kind of only telling one layer of the story when it comes to health equity and sexual violence. We were getting a lot of asks to break down some of our analyses by a third variable or stratify by a second variable and break down by a fourth variable. And even when we answered those questions and dug deeper, it still only felt like we were getting a tiny piece of the big picture. And so, at the time, we were doing a lot of reading as far as new scholarship in the field about why traditional epidemiology methods might not be the best to really model intersectionality and the complexity of, how students experience violence and oppression in the real world. And so when it came time to present these findings to our partners, we were very honest and upfront. We said, there's a lot going on here and we've done a lot here, but we know that there is more that can be done with this data. And we are actively looking to collaborate with anyone who has any technical experience with, the kind of methods that it would take to give this data the love and care it deserves. And at that time, I was pretty new to Minnesota, so I didn't know how much, brain power we had in the room, but we had some very skilled longtime collaborators who were listening. And that is when we got connected with our wonderful colleagues at the U.
Yeah, thanks, Corey, for that handoff. So I've been conducting analyses and writing papers using that Minnesota student survey since 2007. So a long time, like 17 years. And my colleagues and I make it a priority to partner with the Minnesota Department of Health and other youth serving agencies in our local community and state to help translate like complex research findings about Minnesota students into practice. And as Corey was saying, that Minnesota student survey is a super unique data source about adolescent health. It's like the youth risk behavior survey that the CDC conducts, but it's more of a census of almost all Minnesota students. And again, it's really unique because it asks students about critical topics like gender identity, sexual orientation, and sexual exploitation. So for example, in that 2019 survey that Corey was talking about, it was one of the first times that any state epidemiological survey had ever asked a question about trading sex for something of value. And our university team partnered up with the Department of Health to produce some of the first population-based prevalence estimates of trading sex for high school students. So we had been on the Department of Health's radar in terms of these collaborations. And Marissa and Corey and I started working together during the pandemic to dig deeper into how young people were reading and understanding questions on the survey about sexual violence. Because we were noticing some inconsistencies in how students were reporting on the data. We learned a couple of things by talking to 24 young people during the pandemic that people might want to know about students taking those surveys at school. The first is that, you know what, behavior like sexual exploitation, sexual violence is going to be underreported. And that's because students are going to be hesitant to answer questions accurately because of how the data might be used. They might be worried about anonymity. They might be worried about fear of social or legal repercussions. So that's just good to know that any data that we're reporting is likely an underestimate. And then secondly, boy, adults creating surveys need to learn a lot more about how to frame our questions and be less adulty, researchy in our language about asking about sex, anything around sexual violence. So those were just a couple of insights about the fact that young people are going to call things differently than adults do. So as Corey was saying, I was at that presentation that Corey was presenting on the sexual victimization data from the survey, and put that out there that they were looking for people to partner in terms of intersectionality and really digging deep into that type of analysis. And it rang a bell because my teams at the university had just begun trying out different methods to incorporate intersectionality into our analysis with these survey data. And specifically, my colleague Nick here had been advocating that we try to use a strategy that marketing researchers had been using to really dig into intersectionality into our data.
Really interesting. Okay.
Yeah, and so when I think about the beginning and what really brought us together, I actually get brought back to some of our very early discussions that really it kind of solidified for me how much I love our little group and the way that we think and approach our research. And so when we first kind of came together, we had discussions, and this started, like I said, very early on about how legacies of oppression and violence, so like the multiple realities of white supremacy, colonialism, cis heteronormativity, patriarchy, and similar kind of concepts all interweave together, creating this sort of tapestry of experiences that affect rates of intimate partner sexual violence experiences. And so we wanted to better examine that kind of nuance of disparities in intimate partner violence, intimate partner sexual violence, while also considering context, because there's a really important piece that gets missed if you don't contextualize the findings in a lot of this survey data that we're doing. And so instead of just simply creating profiles of individuals who are considered quote unquote at risk or quote unquote vulnerable, we wanted to go beyond that. And we also wanted to move away from this idea that the story is just about their social identities that are at fault or putting people at risk, because that isn't what's happening. We wanted to really focus on social power and structural oppression related to those identities that are really impacting people's experiences around intimate partner sexual violence. And so to be able to do that and to have an approach and to be more nuanced in our examination, we did a lot of talking about how our different fields need to just do better. And some of the conversations that we had are, not only with how can we be creative in our analysis approach, but doing a paper in a project like this is one type of action oriented approach to changing how we do some of this. And so we, again, wanted to be creative, we wanted to be critical, we wanted to stretch our minds not only together, but with the many people that we collaborate with and had conversations with. And ultimately, we wanted to create a more robust picture of what sexual violence disparities for adolescents in the Minnesota context were experiencing and really better support their unique needs with that context in mind.
I so appreciate you sharing about this long-standing relationship, but how you all really all brought your skills together in this effort to do better. We've talked on previous podcasts about how the ways in which data are collected, analyzed, and reported can address or actually cause inequities. Can you walk us through how you actually applied an intersectional approach to your analysis?
Yeah, so there were a lot of different layers to how this analysis became intersectional, and it goes way beyond the statistical method that we chose. It was kind of more like a series of decisions decisions after decisions. And every time we made a decision, no matter how consequential or seemingly small, we tried to do that with the guiding philosophy of intersectionality in mind. And we mean, capital I intersectionality, the theoretical framework proposed by Black feminists, Combahee River Collective, Kimberly Crenshaw, Patricia Hill Collins. So this means thinking about power and history and systems every time we make a decision, and not just how are we going to get the p-value to work. Furthermore, it was important to make the decisions with the people who would be using the data for action. A lot of times, if you're on a multidisciplinary team, there are still kind of these silos that emerge between the people who do, the numbers and the people who do the action. And I find it's really easy to get lost in there. And as a data person, you have to make a lot of choices that seem small or arbitrary about model specification or how the table is going to look. And you think, I'll just handle this. This is my lane. But the more you have these grounded conversations and share the decision-making power with people who, may not have the same technical orientation towards statistics, but have a lot of context and wisdom that you don't, the more you learn that there are no small choices in data analysis. So basically, a quick rundown of some of the decisions that we made as a team, as a unit that was trying to center anti-oppression, intersectionality in our thoughts. We decided to use a method called exhaustive chi-squared. Interaction detection, exhaustive chi-squared automatic interaction detection, or ECHADE, which is kind of a very basic machine learning model that splits a large sample into more focused groups, and it shows you how much internal diversity there is within a large sample. We also, used our decision-making process to talk about how to present the variables we put in, how to talk about the variables, how to choose the variables, how we choose to frame the groups, and how even we present the primary data visualization. We ended up kind of literally turning it on its side, to kind of bust this idea that divisions that we make for the purposes of data analysis and convenience are hierarchical in nature. And so we ended up not necessarily with groups that were at odds with one another, but groups that were connected in a larger web of experiencing violence and solidarity together. Yeah, and there's so much more we could talk about. I'm going to pass the mic for a minute.
So going off of some of what Corey's also already said, is when we think about intersectionality, it isn't simply about the type of quantitative analysis that we use. And I think that's a really important point to make. Intersectionality is a critical analytic framework. So it's about thinking critically about all these aspects of the research project, and just kind of uplifting a little bit more about intersectionality. Again, it came out of the work of Black along with additional women of color feminist scholars. And that's been like this concept, even before the term intersectionality was a term, has been advanced for years and years and years to bring attention to oppression and privilege and systems of power that affect people in their daily lives and are resulting in these inequities and disparities that we're talking about. So when we're incorporating intersectionality, it goes beyond focusing on multiple types of identities that overlap. And in the literature, Lisa Boleg and some other folks have written about when we focus on just multiple identities itself, this is actually called flattening intersectionality. And so it's really about thinking about how power and oppression based on those intersecting identities shape the opportunities, the access, the resources, the various experiences, and so on that manifest in people's lives or don't manifest in people's lives and affect their well-being. And so in our particular research process, intersectionality was incorporated from, like I mentioned earlier, from the beginning about being reflexive as researchers to discussing topics such as whose voices are represented, who's included in the research process, who's the research audience, as well as how are our own lived experiences at times, even like when looking at the data, choosing which variables, how we're interpreting it, how do our own lived experiences, our own kind of like biases in the world, our own framework on the world affect how we're interpreting or choosing what gets included or not, and how we even show this in a paper. And so again, in our work, we got very detailed at times about this, discussing even like specific words when we're and when we think about power and oppression, that brings us to history and how histories of structural racism and associated violence, how that's really important even in our language and terminology. And so just as an example, a lot of the times the Minnesota Student Survey in itself is described as a surveillance survey. And so we've kind of moved away from using that language. And this is just one example to describe that survey, because surveillance, that word holds so many different meanings to different groups of people, particularly with regards to history, modern day oppression, the social political climate, violence, harm. And so, as Corey said, our approach to this research project, or what Corey kind of alluded to, took a lot of intentionality, and it also required a willingness for all of us to slow down and grapple and really like think about the complexities that truly exist and do so in a way that takes the onus off of the individuals and the participants that are in the survey, but also who the survey represents. So it takes the onus off the individual and onto the systems and structures that are leading to disparities.
It's really powerful to hear about your approach, because I can feel how it did these two things at the same time, which you wouldn't think would happen. It really showed the complexities of the issue of sexual violence, but also is making it more accessible for people to be able to see how those complex systems are all around us. So that just hearing you describe your process, it's just I'm having these wonderful pictures of that slowing down, really being thoughtful, applying this systems analysis, but also really showing people as full human beings instead of a single identity. So I'm really excited too to now talk to you all about what your analysis revealed. Corey, could you talk to us a little bit about that?
Yeah, I'm so interested in how you talk about the study as like making this topic more accessible, because I think intersectionality is a concept that is at the same time kind of necessarily complex and difficult to describe and visualize, but also kind of intuitively true for anyone who's paid attention to the lived context that we find ourselves in, in our current society. And, that kind of speaks to a lot of how we process the results of this project. A lot of it was, on one hand, stuff that we could say we already knew from decades and decades of, multiply marginalized people telling us through lived experience, through scholarship, through, literature, everything, that people who do navigate more than one force of systemic oppression, experience a type of marginalization that is more than just the sum of each marginalization on its own. And, it's on the other side of the coin, people who are multiply privileged experience privilege in a way that is synergistic and more than just the sum of each privilege on its own.
Thank you for listening to this episode of Resource on the Go. We hope Part 1 piqued your interest and you will listen to the rest of the series that explores results of the survey and action steps in the community. For more resources and information about preventing sexual assault, visit our website at nsvrc.org. You can also get in touch with us by emailing resources at nsvrc-respecttogether.org.